First, I want to apologize for being a little quiet lately. I've been pretty busy, and unfortunately, I haven't had a chance to make a new video. But I'm back, and I've got some important health information to share with you today. So stick around because this is something you definitely don't want to miss. Let's get started. 5 people are dead, 9 people were hospitalized, and every single one of them had one thing in common. So far in 2026, the Louisiana Department of Health has confirmed 9 cases of a bacteria called Vibrio vulnificus. All 9 of those people ended up in hospital. 5 of them did not survive. Now let me put that number in perspective for you. Over the previous 10 years during this same period, Louisiana averaged about 7 cases and 1 death. 1. This year, 5. But here's the part almost nobody is talking about. Health officials confirmed that every single one of those 9 patients had an underlying health condition. Not one of them was a healthy young person. And if you are over 50, that sentence is about you. So stay with me because in the next few minutes, I am going to show you the exact conditions that put a person in the high-risk group, the one early warning sign that people ignore until it is far too late, and the simple 30-second precaution that could have prevented all 9 of these infections. Delivery, warmer now. Logo sting can play under the first line. Keep this section short, every extra second here. I am Dr. Alex. Before we begin, one important note. This video is general health education. It is not medical advice for your individual situation, and it does not replace a conversation with your own doctor. If you have symptoms, please contact a healthcare professional. With that said, let us get into it. Before we go further, do me one favor. Type the name of your state in the comments. I want to see how many of you are watching from the Gulf Coast because this information matters most to you. Number 1. What actually happened in Louisiana? Let us start with the facts, because there is a great deal of frightening and inaccurate information circulating right now. On the 6th of August, the Louisiana Department of Health issued a public advisory. 9 cases of Vibrio vulnificus have been reported among Louisiana residents this year. All 9 patients required hospitalization. 5 of those illnesses resulted in death. Officials also confirmed something very specific about how these people were infected. All 9 cases were associated with wounds exposed to seawater. Not seafood, not oysters. Wounds. The patients were exposed at multiple locations across the state, and one exposure happened in another Gulf Coast state. Now, state epidemiologists have made an important clarification. The number of cases itself is not unusual for this time of year. What is unusual is the death toll, and this is not limited to Louisiana. Florida has also recorded deaths from the same bacteria this year. Nationally, somewhere between 150 and 200 cases of Vibrio vulnificus are reported each year in the United States, and roughly half of them occur in the Gulf states, Texas, Louisiana, Mississippi, Alabama, and Florida. So this is a regional pattern, not a single unlucky beach. No. 2. What is Vibrio vulnificus? So what is this bacteria exactly? Vibrio vulnificus is a bacterium that lives naturally in warm coastal and brackish water. Brackish simply means the place where fresh river water mixes with salt water, the marshes, the bayous, the estuaries, the river mouths. This is not a new organism. It is not an escaped laboratory germ. It has always been there. What matters is the temperature. These bacteria multiply in higher numbers between May and October when the water is warm. We are in August right now. This is peak season. And there are only 2 ways it gets into a human body. The first is through a break in the skin, a cut, a scrape, a blister, a fresh tattoo, a surgical wound that has not fully healed, an insect bite you have scratched open. If that opening touches contaminated water, the bacteria has a door. The second is through the mouth, specifically raw or undercooked shellfish, oysters above all. That is it, 2 doors. And in this Louisiana outbreak, every single case came through the first one. Number 3, why flesh eating? Now you have seen the headlines, flesh-eating bacteria. It is a terrifying phrase, and I want to explain what it actually means because the truth is somewhere between the panic and the dismissal. The bacteria do not eat flesh. That is not how it works. What happens is that in a severe infection, the bacteria release substances that destroy the soft tissue underneath the skin, and they do it very quickly. Doctors call this necrotizing fasciitis. The tissue dies faster than the body can defend it. The bacteria can also cross into the bloodstream, which causes sepsis, a whole-body reaction that is a genuine medical emergency. Here is the statistic that explains why health officials use strong language. According to the Louisiana Department of Health, about 1 in 5 people with this infection dies, sometimes within 1 or 2 days of becoming ill. Many of those who survive require intensive care. Some require amputation of a limb. 1 or 2 days. I want you to hold on to that because it changes what you should do when symptoms appear. I will come back to it. Subscribe. If information like this is useful to you, please subscribe and turn on the notification bell. I make one clear, practical health video every week specifically for adults over 50. No hype, no scare tactics, just what you actually need to know. It is free and it helps this channel reach more people who need it. Number 4. The warning signs after water exposure. Let us talk about symptoms because early recognition is genuinely the difference between a course of antibiotics and an intensive care unit. If the bacteria enters through a wound, the first signs appear around that wound. Redness, swelling, warmth, pain. So far, that sounds like any ordinary infection. Here is what makes this one different. The single most important warning sign is pain that is far worse than the wound looks. Let me say that again, because this is the sign that gets missed. If you have a small scratch, something that looks minor, something you would normally cover with a plaster and forget, but the pain is severe and it is getting worse by the hour, that mismatch is a red flag. Doctors call it pain out of proportion. The other signs to watch for are redness that is visibly spreading, swelling that is increasing, skin that is changing color, and blisters forming around the wound. Louisiana health officials specifically noted that blisters from this infection can spread rapidly. Fever and chills can develop alongside all of this. And if the infection has reached the bloodstream, you may see extreme weakness, dizziness, confusion, or a drop in blood pressure. Confusion in an older adult in particular is never something to wait out. Number 5. The warning signs after eating shellfish. When the infection comes from contaminated shellfish instead, it looks different at the start. It usually begins as a stomach illness, watery diarrhea, vomiting, abdominal cramping, fever, and chills. For most healthy people, that is where it ends. But in a high-risk person, the bacteria can pass out of the digestive tract and into the bloodstream. This is called primary septicemia, and it can turn life-threatening quickly. In some of these cases, blistering skin lesions appear on the arms and legs, even though the infection came from food, not from a wound. That combination, stomach illness after raw oysters, followed by skin blisters, is an emergency. Number 6. Who is actually at risk? This is the core section for the after 50 audience and the retention peak. Slow down noticeably. Consider on-screen checklist graphic listing the conditions one at a time. Now we arrive at the most important part of this video, because the honest truth is this. For a healthy 50-year-old with intact skin, the risk of dying from this bacteria is very low. The risk is not evenly distributed, it is concentrated. And it is concentrated in people who, statistically, are mostly over 50. Health officials have identified the conditions that raise your risk of severe illness. Listen carefully because this list is longer than most people expect. Liver disease. This is the single biggest risk factor, and that includes fatty liver disease, cirrhosis, and hepatitis. Cancer or treatment for cancer, diabetes, HIV, thalassemia, and other conditions affecting iron levels. Any medication or therapy that suppresses the immune system, including steroids and transplant medication. Medicines that reduce stomach acid, and I want to pause on this one. Recent stomach surgery. That stomach acid point deserves a moment. Millions of adults take acid-reducing medication every day for reflux and heartburn. Many have taken it for years without ever being told it is on this list. Your stomach acid is a defensive barrier. It kills bacteria that arrive in food. When that acid is chemically reduced, more bacteria survive the journey. I am not telling you to stop your medication. Please do not do that. I am telling you that if you take it, raw oysters carry more risk for you than they do for the person sitting next to you at the table. And remember what Louisiana officials confirmed. Every one of the 9 patients this year had at least one underlying condition. Being in a high-risk group does not mean you will be infected. It means that if you are infected, the outcome is far more likely to be severe. If someone in your family has diabetes, liver problems, or takes medication for acid reflux, please stop and send them this video right now. Not later, right now while you are thinking of it. It takes 10 seconds and it may genuinely prevent a hospitalization. Number 7. Swimming, wounds, and raw oysters. Can you get it from swimming? This is the question I am asked most, so let me be clear. Swimming in the ocean does not automatically cause a Vibrio infection. Millions of people swim in the Gulf every summer. Intact, healthy skin is a very effective barrier. The bacteria needs an opening. So here is the guidance from Louisiana health officials, and it is refreshingly simple. If you have a wound, either stay out of salt water and brackish water entirely, or make sure the wound is covered with a waterproof bandage before you go in. A waterproof bandage, not a fabric plaster that soaks through in 30 seconds. And that same rule applies to handling raw seafood or its juices in your kitchen. If a wound does get exposed, wash it thoroughly with soap and clean running water afterwards, and then watch it closely. 30 seconds of preparation. That is the precaution I promised you at the start of this video, and it is the one that would have made a difference in all 9 of these Louisiana cases. What about raw oysters? Oysters deserve their own warning because of how they feed. An oyster is a filter. It pulls water through its body continuously, and whatever is in that water concentrates inside it. If the surrounding water contains Vibrio, the oyster can carry a far higher concentration than the water itself. And a contaminated oyster looks completely normal. It smells normal. It tastes normal. There is no way to identify it by sight, by smell, or by the shell. Let me also address the kitchen myths directly. Lemon juice does not make a contaminated oyster safe. Hot sauce does not. Alcohol does not. A drink alongside your oysters does not. Heat does. Cook shellfish thoroughly and the bacteria are destroyed. If you are in one of the high-risk groups we discussed, this is not a suggestion to eat fewer raw oysters. It is a recommendation to stop eating them. Number 8. Treatment and when to go immediately. If an infection is suspected, treatment depends entirely on how far it has progressed. Early on, a doctor may examine the wound, take samples for laboratory testing, and begin antibiotics. A severe infection is a different situation altogether. That means hospital admission, intravenous antibiotics, and often surgery to remove tissue that has already died. When the bloodstream is involved, it means intensive care. Which brings me back to the number I asked you to remember. 1 to 2 days. This infection does not give you a week to think it over. It does not politely wait until Monday morning. So here is my instruction to you, and I want it to be unmistakable. If you have been in salt water or brackish water with any break in your skin, and you then develop rapidly increasing pain, spreading redness, swelling, blisters, discolored skin, or fever, do not wait. Do not sleep on it. Go and be seen the same day. And if you have eaten raw shellfish and developed severe stomach illness with fever, weakness, or any skin blistering, the same rule applies. Then say this sentence to whoever treats you. I was in salt water with an open wound, or I ate raw oysters. That one sentence changes the clinical picture immediately. It tells the doctor which bacteria to consider and which antibiotics to reach for. Do not assume they will guess. Tell them. Number 9. Your 5-step protection plan. This is the most screenshot shared moment of the video. Make the graphic clean. So let us make this practical. 5 steps. 1. If you have any break in your skin, stay out of salt water and brackish water. If you must go in, cover it with a waterproof bandage. 2. Wear gloves when you handle raw seafood, and keep its juices away from any cut on your hands. 3. Cook all shellfish thoroughly. If you are in a high-risk group, avoid raw oysters completely. 4. Know your own risk. Liver disease, diabetes, cancer, a suppressed immune system, or acid-reducing medication all place you in the higher risk group. 5. Act on the same day. Rapidly worsening pain after water exposure is an emergency, not a wait and see. 5 steps, none of them expensive, none of them complicated. And together they remove almost all of your risk. So let us bring it together. Vibrio vulnificus is a naturally occurring bacterium in warm coastal water. It is at its highest levels right now, between May and October. It enters through broken skin or through raw shellfish. It can move very fast, and about 1 in 5 people who develop this infection do not survive it. But it is almost entirely preventable. Cover your wounds, cook your shellfish, know your risk, And if something starts hurting far more than it should, be seen the same day. Do not live in fear of the water. Live with awareness of it. Now, 3 quick things. First, share this with one person you know who has diabetes or a liver condition and lives near the coast. One share genuinely could prevent a tragedy. Second, subscribe because Louisiana health officials have said they will be publishing weekly updates on this, and I will cover any significant change here on this channel. And third, if you take medication for acid reflux, watch the video appearing on your screen now, because there are several other risks associated with long-term use that very few people over 50 are ever told about. I am Dr. Alex, and this is Dr. Alex Senior Health Center. Take care of yourself, look after the people around you, and I will see you in the next video.